is a University of Ghana medical center where some persons with COVID-19 are being treated. More than 20 persons were brought here for care. Here is Chief Executive Officer Dr. Darius Osei.
The first patients we had were those who were discharged from the hotels, if you recall. Those who were isolated when they arrived on the 21st of March were sent to hotels. Some of them tested negative in the beginning, and then when they were about to exit, they tested positive. So there were 26 of them who were brought to us. They stayed with us for 9 days, and then they were tested again. They got negative, and then within 24 hours, a second test was done, and then about 18 of them went home. So if you ask me, we have about 8 patients with us. That is the normal treatment place. And then we still have about 3 patients at the ICU. That is those whose conditions require support with ventilators.
He admits this is a crucial point in the life of a country as the world battles the pandemic, which has affected over 2 million people and killed more than 200,000 others.
This has been the most difficult time for health workers, but they have really done well. In the beginning, people were skeptical but we encourage ourselves. I have been coming to work almost every day, Saturdays and Saturdays, just to motivate my staff. We visited Ghana East Hospital, which was first designated as the treatment center. And all the doctors and the nurses went there to see for ourselves the patient experience and then the provider's experience. And this encouraged my staff. And after that, I'm sure they all came on board. So far, most of these frontliners have been tested, and none of them have come out as positive, which means that we are actually following the protocol of protecting ourselves. And I'm sure it is going to become one of the normal conditions that we manage if we follow the protocols and protecting ourselves well. So we've tried to demystify the myth that comes around it. And I hope that the stigma will also gradually go away, and then we will all begin to think that it is one of the normal things that come in our lives. And so far as we prepare ourselves as providers, we should be able to stand the test of time. And so far, I will congratulate my staff. They have done very well, and we hope to continue.
Today we are going to have an exclusive access to the patient tower here in the facility, which is holding, we understand, 8 individuals who have been infected by the virus. I'm joined by Dr. Emmanuel Amoah. He is one of 2 specialists here at the facility who will be taking us on a tour. What should we expect? I mean, I'm not scared. I want to see this.
Yeah, so I think there's nothing to be scared of. We need to just prepare as we see the patient. So we are going to take you through the pathway to access care when you test positive. I'm here with my colleague, Dr. Ama Edwin.
Dr. Ama Edwin, I don't know how to describe you, but you're an interesting personality. I mean, the brief interaction I've had with you, you appear very, bubbly and everything. I expect that this tour that we're going on won't leave me traumatized at all.
No, it will not. It will not. I think at the end of it, you'll be able to say, you will not be traumatized. And if you experience any trauma, you are in good hands. So.
Great. So, Dr. Ama Edwin there, Dr. Emmanuel Amoah, they're going to take us on this tour. Come with us and let's just demystify, a lot of the things that are being bandied about COVID-19 and the people who have contracted the virus. Let's go.
So we are following a route to where the frontline health workers are.
Okay.
That is where we get prepared before we go see patients.
I like the fact that you said patients who have COVID-19 and not COVID-19 patients, because that's the language we want. When you say COVID-19 patients, stigmatizing, but when you say patients with COVID-19 or person with COVID-19, so thumbs up.
Soaked with chlorine. So you step on it to disinfect your boots.
Actually, we are in Crocs, so this is to disinfect our Crocs.
So this is what we do.
We'll have to do the same.
You have to do the same with your shoes. This is to, this is chlorine solution. So when it comes into contact with any contamination, let's say the virus, then the virus is destroyed or killed, if I put it that way, so that we are clean before we go in. As you can see, this is a very changing room.
Okay.
Frontline workers will change. Yeah, they will wear their scraps, as I'm wearing, before they start work. All right.
So we are essentially in the building.
Essentially in the building for frontline health workers.
Okay. The PPE room. I'm sure many of you will be interested. The PPE room.
This is where we don. We wear the appropriate. We wear the appropriate scraps or personal protective equipment before we go and see a patient.
Okay, so that will include the mask, the scraps, the gowns, the coveralls.
The coverall, what to wear over your head, the head covering, the goggles. Some of the goggles, typically the face shield is outside, but all the other PPEs are here. So based on the patient that you are going to see and the work that you are going to do, then you wear the appropriate PPEs. All right.
Okay, yeah, so the donning area.
So when you enter, you wash your hands as well. We are going to wear our full PPE. The reason is simple. When you go in there and then anybody needs any care, because we are in full PPE, we can offer the level of care, the needed care for every patient. If you are not fully donned, then when you go in, there may be some procedures you may not be able to do because you are not in the appropriate personal protective equipment.
I'm looking forward to see how the donning is done in the appropriate ways of donning the PPEs.
So there are protocols, and the protocols have steps. So the steps will be followed. So we have supervisors here whose sole responsibility is to make sure that healthcare workers are donned properly before they go to offer service. So now we are going to turn you today also to frontline health workers, possibly give you the full PPE for you to appreciate what healthcare workers go through when they need to offer care for COVID-19 patients.
You know me, I told you that I'm up for this, so no problem at all. I'm ready to also don the PPEs. It's going to be a revealing experience for me as well. So it's been a few good minutes, trying to get myself in this. I have to tell you that it's not an easy process. My camera technician, Sami Asante, is here with me. Sami, are you sure you can breathe?
I'm managing.
And I'm going to go in the treatment area with Sami Asante, also with Dr. Emmanuel Amwa and Dr. Amma Edwin.
So now we are going to go into the patient area or the treatment area.
And we know that there are 8 people here.
Yes, all of them are not here now. Some are the intensive care unit, those who are critically ill or severely ill. But those we have here are patients who are stable.
Okay, great.
Who are mildly ill or asymptomatic.
Okay, so as you can see, the isolation area, we're getting in. There's nothing to fear really. From what I've been told and the discussions I've had with Dr. Amwa and Dr. Edwin, this is nothing scary at all because many of the individuals, as we know, are asymptomatic. Let's go.
And then we have also taken the appropriate measures to protect ourselves.
As you can see, great.
So as you can see, this is the treatment area. The rooms that you have seen numbered are the rooms for patients.
Okay.
Last week we discharged about 20 of our patients, close to 20 of our patients, so the place is a bit quiet now. And so all these labeled rooms are rooms that we have for patients when they come in.
Let's just get into one of the rooms and really just observe. Okay.
We have this is a 2-bed room, so one patient or two can be here. If you have a couple, by all means, that two will be here.
They have literally everything.
Yes, everything is, and the place is carefully prepared for anybody who is unwell and comes in. Yeah.
This is just one of the number of.
Yes.
So that's the washroom, as you can see. Okay, great.
Yes, so welcome to our treatment area where we have our patients. We have some of our patients here who are willing to talk to you within. Yeah.
And I have to say that they have agreed to do this because they trust that we're going to protect their identities, etc., and privacy.
You will help me to answer to that.
You have our word that we're going to
All
be
right.
professional.
And also this to demonstrate that COVID-19 is real in Ghana. As we know, it's a pandemic, global. We have patients that we are caring for here as well.
I mean, it's ridiculous to think that some people still in this era believe or think that the COVID-19 is a hoax. So yes, it is real. There are individuals who, have contracted it, etc., and are getting care. And we know also that, if you get COVID-19, they are not going to die, really.
Yes, they are getting better.
So let me just have a brief interaction with, one of the individuals in this treatment area, the UGMC. How are you doing?
I'm doing better.
When did you come here? When were you brought here?
I came here on last Friday. That was on 17th.
If I may ask, did you travel out? Did you come into Ghana in the last 1 month or 15, 20 days?
No, I was here for 4 months. I haven't traveled anywhere.
And I believe that you are being taken through the treatment and everything is going well.
Yeah, sure, everything is going well and we are under the treatment and we are getting better.
And let me just understand, at the point your samples were taken and the tests were conducted, what was running through your mind? When the samples were taken, did you have any fears or concerns that you may have contracted the virus at all?
No, the time when they taken the sample, I was free that the test will be negative. But when the test came, it was a positive test. It will feel like it will give you a sudden attack that how can it be a positive? But
had you around the time come into contact with anybody who you suspect may have had the virus, and so you may have contacted that person or contracted it through the contact with that person?
yeah, might be. I'm not sure, but might be.
And there are people who still believe or still think that all the noise we are making that COVID-19 is in Ghana is a hoax. Do you have any message for people like that?
Yeah, this virus is seriously very serious. We can't take it very lightly. As I'm here for past 1 week now. I was suffering a breathlessness, but because of the doctor's team over here and the staff management, I'm getting better over here.
Okay, so let me just quickly have an interaction with a second individual here. They've been, generous and willing to grant us this exclusive interview or audience. Thank you very much, ma. How are you?
Oh, doing well. The doctors have been very supportive, and the jacks have been working, so we're fine.
When were you also brought here?
On the 20th. About a couple of days ago. 20th April. Yeah.
How it all happened? When the contact tracers or the health experts came to take your samples, etc. What was the whole scenario? Paint for us that picture.
Well, for me, I was a bit too curious. I think I already figured out that I had it, considering the symptoms. I actually got the symptoms from day one. So I got the terrible headache. I got the fever. I got lots of smell and taste. I got almost everything except the sore throat, and then the shortness of breath. Anyway, so it was kind of like the sample test just confirmed my fears. Yeah. Psychologically, it's been very scary. It is scary. I mean, if you have all the symptoms, then obviously you'll be very scared. You can't sleep at night, you're sleepless, you're restless. It's pretty hard. You don't know what can happen to you the next day. So it's very dangerous illness. I won't wish it for anybody.
And you speak about the fact that you suspected because of all the symptoms you had got at the time. So at what point were you tested?
I was from the time I got the symptoms, I was tested about 4 days during the symptoms. So I got the headaches for about 2-3 days, and then on the 4th day I got the fever, and that's when I realized that, and I got the runny nose and the blocked nose actually. So that's when I realized that I had to call it in. So when they sampled, a sample came in about a couple of days after, but I was already doing my own treatments, in-house remedies and all that. So that was what helped me, get better at least.
So when they communicated to you that, okay, this is the test result, we have to take you into care, just paint a picture for us, that time, the breaking of the news to you, the time they had to tell you to come here and all of that.
Yeah, so for me, by the time that the sample test came in, where I was positive, I had already been self-isolating in my house. So I had all the resources to keep myself from infecting others, and I kept to myself and at home. They served me outside my door and everything, so nobody was actually affected. However, when it got serious a couple of days ago, because I actually wasn't breathing properly, so I had to come in so that they can monitor me properly with oxygen and so on, support, and so that's how. But psychologically, it's actually not been easy up till now. It's not.
I can imagine. This is really, it will be draining, one, physically, psychologically, etc. But how are you keeping up though?
Well, you have to distract yourself. I think that for me, I actually distract myself with family, keeps calling and checking on you. It's very important to have family by your side. If they are also, if you're stigmatized by your family, that's number one. That's dangerous. You also break down. You can never tell what symptom can trigger with that. So my family has been very supportive in that aspect, and my friends too as well, my workplace as well, and it's been cool.
We've been having to talk about issues of stigma in the last few days because some of the people who have even recovered and gone home are being shunned by people in the neighborhood, their church, their workplaces, etc. When you hear some of these stories of stigma, how does it make you feel?
It makes you scared. I am scared. Even if I leave here and I'm actually recovered, I don't know what I'm going to face outside, how people will perceive me in my neighborhood, especially among my friends. But the thing is that I think that it's best that you don't tell people. The less people know about it, the better. Even though you wish you would have told them to help them, stay safe. But at the end of the day, the stigmatization in this country is serious. You wouldn't want to go through that. So for now, we're just keeping our fingers crossed.
All the best, and we know that this shall pass, as we've been saying. But I want you to encourage other people out there. There are people who, one, do not want to go and subject themselves to the test, even though they may have come into contact with the case, etc. So for people like that, what will be your word for them?
It's better to know, or it's better to be safe than sorry. Because I'm just imagining if you may have the symptoms. One thing about this illness is that it triggers different symptoms each and every day. Today might not be serious, tomorrow you don't know. Especially when you're sleeping and you have difficulty breathing. So it's always best to know now than later when you go into critical mode. That is not also good. So I would encourage everybody to do the tests if they have any symptoms. But the most important thing to do is to practice social distancing. It's very important, and it's the best practice.
Unfortunately, it appears the issue of social distancing has been thrown to the dogs. People still go crowding in the markets. The traders themselves, looks like they still don't understand exactly what we're talking about, etc. I want you to speak to some of those people who have taken all this for a ride and are just going about life as usual, as if nothing is happening.
I'm an example. In total, it's been about 21 days since I had this illness. So you can just imagine the trauma I've already faced. So if you're telling you to stay home, practice safe distancing, and you're not doing it, then you have a long way to go. It's dangerous. Keep yourself out of harm's way. Wash your hands as much as possible. I mean, wear your face masks and all that. Just be safe out there. It's a very dangerous illness. I won't wish it for anybody.
Heard for yourself the testimonies of these individuals who are being treated for COVID. And Dr. Amma, I mean, listening to some of the things they were telling me, that even the issue of trauma alone is something they're having to deal with. Yes. And also they fear that after here, the stigma out there is real.
Yes, it's very real. Very real. So we sort of try to give them the needed psychological support counseling through Dr. Amma Edwin, and the little that we can also do. And then when we discharge them, we plan their discharge carefully so that we take them home into the community without them being noticed that they are coming out from the hospital. And we keep in touch with them so that as we go along, we monitor them, we talk to them so that they can be able to live with that challenge or that stigma that comes along. But we are trying to help people to also appreciate that it's not the fault of anybody to be infected with COVID-19, including healthcare workers. So we need to be confident about what we are doing and also to try to support those who are infected to recover fully and come back to enjoy their lives they are already enjoying. So that is the message we want to give to our friends, our neighbors, our family members, that anybody at all can be infected. But if you are infected, we give you the needed support and the treatment, and you get better.
Okay, Dr. Edwin, I mean, you are having to, deal with these people and their psyche as they were brought in here and as they are going through the treatment processes, etc. Do you get the sense that these people on their own are coming out of the psychological block that all this has created for them?
Well, this one would affect anybody. I don't know anybody who would not be affected. And even those of us, Dr. Amma and I were changing stories and laughing. We both had our samples taken on Thursday. He had some symptoms. I had some funny cough, itching in the throat. My son was sick, and then suddenly my mind was playing tricks on me. I had to calm down. My husband had to calm down. Even said, so the worst case scenario, you've got it, so what? I mean, we will handle it. So the psychological impact is real. I think what Dr. Amma said is so important because it can happen to anybody. So you think you are stigmatizing somebody, you might be stigmatizing yourself. So we need to support. One thing I've also seen is that communities have developed. People come here and they bond. Some of our patients who left, they call and they tell me that they are still in touch. So it's like we've gone through a trauma together, a challenging experience, so many unknowns. This is a new virus with so many unknowns, but that community of care that has developed among the patients themselves and among even those of us working here, we look out for each other, we encourage each other, we support each other. That's how we beat this. We need to be there for each other rather than stigmatizing people and their families and even healthcare workers working in the front line.
So generally, this is how the patients also come out to get fresh air, to sit down and to talk to doctors.
Okay.
So all this that you see is more or less like the review area.
Okay. Even the sitting arrangements
yes.
are interesting.
Yes. So the patients come out, then they sit down, and then we interact with them out, as you can see now.
And they would only have the mask. We won't see
yes.
When we are reviewing, it's only the mask that we need. So the patient will be sitting there, the doctor will be in their scrubs, and then the masks, nothing else. And
so we have just returned from the tour of the facility, and here. And so what is the name of this process?
Okay, so we are doffing. We started the doffing off process. So this is a chlorine. We are putting in we've been working there, so we are putting in I can't say boots, am I right? The gown boots. This one is the gown boots to make sure that it is decontaminated, and then we'll go through the process.
Okay, so Dr. Amma also have to do that. 15. What you see is the disinfection process. They had to do the chlorine bath, one here, one there. The concentration of the chlorine is 0.5, and we see the supervisor there spraying Dr. Edwin, and Dr. Amwa will follow. What a revealing experience it has been here at the University of Ghana Medical Center. You've seen it all for yourself. You heard from those who are working closely with people who have been afflicted by the coronavirus. The simple message running across is, let's stop the stigma. Stay home. If you have nothing to do at home, practice social distancing and all the hygiene protocols that have been outlined, and you will simply be helping the health workers deal with the pandemic. So from here, the University of Ghana Medical Center, for Joy News, I am Komla Adum reporting.